Hello and welcome. I'm Dr. Lauren Pierce, a consultant andrologist specialized in male sexual health and vascular medicine, working with men across Europe. Today, you and I embark on an in-depth journey to reclaim not only functional vigor, but also confidence, independence, and overall well-being after the age of 60. In this comprehensive lesson, I want to address the real underlying pathophysiology behind male functional decline. For too long, men have been told, it's just age, it's just stress, or it's just your mind. But as the science of andrology has advanced, we now understand that the interplay between vascular health, hormonal regulation, endothelial function, and neuropsychological factors is the real determinant of a man's sexual and physiological vitality. Let's begin with a case from my clinic in Copenhagen. Mr. Henrik, a 68-year-old retired engineer, came to me deeply discouraged. He had experienced progressive erectile dysfunction, classified as organic ED based on the International Index of Erectile Function, IIEF-5, despite trying phosphodiesterase type 5, PDE5, inhibitors with minimal response. His main complaint, not only loss of erections, but also loss of energy, diminished libido, and even increased fatigue and mild anhedonia, a common sign of late-onset hypogonadism. After a thorough workup, including Doppler ultrasound of the penile blood flow and assessment of serum total and free testosterone, I discovered suboptimal arterial inflow and borderline low testosterone. But the real surprise came from a simple but elegant clinical test. I asked Henrik to compare the temperature of his inner thighs to that of his calves and forearms. He was astounded. His thighs were noticeably cold to the touch. This was a red flag. The femoral artery, a major vascular conduit, is often the first to demonstrate early atherosclerotic changes, leading to what is known as peripheral arterial disease, PAD. But here's the clincher. PAD is not just about walking pain or limb ischemia. Even mild subclinical PAD translates to compromised penile hemodynamics and critically a reduction in nitric oxide, NO, bioavailability, a vasodilator essential for both systemic and penile endothelial function. Cold thigh skin indicates impaired perfusion, often preceding overt coronary artery disease or cerebrovascular risk. Men in this situation face a threefold higher risk of future myocardial infarction and stroke. So what do we do? First and foremost, we must understand that male sexual function is an end-organ reflection of whole-body vascular health. Step 1 is assessment. I teach all patients a simple home method called the cutaneous reperfusion test. Press your palm to your inner thigh and hold firmly for 30 seconds. Upon release, count the seconds until the blanched skin returns to normal color. 3 seconds or less, normal microvascular function. 8 to 10 seconds or more. Microcirculatory impairment, suggestive of significant autonomic and endothelial dysfunction. Henrik's skin took 12 seconds to recover. Step 2 is to address modifiable vascular and endothelial risk factors. Hypertension, high blood pressure, dyslipidemia, elevated LDL, low HDL, high triglycerides, hyperglycemia and insulin resistance, smoking, nicotine toxicity, sedentarism, inactivity, chronic psychosocial stress, increased cortisol. But beyond medical management with statins, ACE inhibitors, or glucose-lowering agents, I focus on non-pharmacological, evidence-based interventions. The 5-minute vascular rejuvenation protocol. This has 4 components that any man can do at home, based on published studies in vascular medicine and rehabilitation science. A. Eccentric enhanced sit to stand. Sit down from standing slowly over 5 seconds, engaging quadriceps and gluteal musculature eccentrically. then stand rapidly in 2 seconds, contracting concentrically. This pattern creates a pulsatile shear stress stimulus, proven to increase no production in the endothelium. B. Isometric knee against hand resistance. Lift each knee toward your chest. Press down with your palm to create isometric contraction of the hip flexors and thigh adductors. Do 10 repetitions per leg to recruit deep arterial beds. C. Bilateral soleus pumps. Stand, then slowly rise onto your toes, plantar flexion. Hold for 1 second, then return heels to the ground. Repeat for 20 repetitions. This maneuver activates the calf muscle pump, augmenting venous return and perfusion throughout the lower limb. The soleus muscle is sometimes called the second heart of the lower body. D. Transcutaneous myofascial massage. Using mild pressure, massage the inner thigh upward from knee toward groin for 30 seconds each leg. This technique has been shown via thermography to enhance local circulation and lymphatic drainage. All steps combined take barely over 5 minutes. The optimal time is immediately upon waking, when diurnal hormonal surges, especially morning testosterone spikes, can be harnessed for maximal vascular and metabolic benefit. Medical research confirms that such daily targeted muscle activation increases local endothelial nitric oxide, enhances arterial compliance, and primes the autonomic nervous system for improved sexual response. Step 3. Functional nutrition. Mr. Henrik, like many Northern Europeans, undervalued micronutrient timing in sexual vascular function. Here's the protocol I prescribed, all based on robust meta-analyses in clinical nutrition. Boost dietary L-citrulline and L-arginine, fresh watermelon juice, rich in citrulline, cooked lentils, and pumpkin seeds. These natural precursors raise plasma arginine and enhance no-synthase activity. Prioritize omega-3 fatty acids, oily fish, flaxseed oil, walnuts, which lower pro-inflammatory eicosanoids and stabilize endothelial cells. Focus on magnesium and potassium. Leafy greens, bananas, and nuts improve smooth muscle relaxation and lower sympathetic overactivity. Zinc supplementation. For those with borderline low testosterone, addition of 25 to 40 μ elemental zinc daily supports testicular Leydig cell function. Step 4. Neuroendocrine recalibration. Chronic stress is the most potent endogenous toxin for vasculature and sexual function. Activation of the hypothalamic pituitary adrenal axis increases serum cortisol, directly inhibiting not only testosterone biosynthesis, but also erections via vasoconstrictive effects. Therefore, I prescribe a daily 10-minute stress regulation sequence. Abdominal breathing, diaphragmatic breathing. Inhale for 5 seconds through the nose, focusing on expanding the abdomen. Exhale for 7 seconds slowly through pursed lips. Progressive muscle relaxation. Systematically tense, then release. Gluteal and thigh muscles. Evidence from neurophysiology journals shows rapid reduction in cortisol and increase in parasympathetic tone. Guided imagery for positive sexual memory recall. Visualize moments of past confidence, focusing on sensation, mastery, and satisfaction. Harvard and European neuroimaging studies confirm that such mental practice rewires default neural circuits, a manifestation of experience-dependent neuroplasticity, for improved confidence and functional outcomes. Step 5. Sleep and hormonal optimization. Sleep is the foundation of all endocrine activity, particularly for sustaining luteinizing hormone LH pulses and nocturnal testosterone secretion. I recommend no screen time for 2 hours before sleep. Blue light blocks melatonin secretion. Maintain sleeping quarters at 18 to 22 degrees, optimizes deep sleep via thermoregulation. Ensure 7 to 9 hours sleep. Most testosterone is produced in deep non-REM cycles, especially between 11 p.m. and 2 a.m. Clinical pearls and adjunct medical options. For patients with moderate jugular and femoral artery atherosclerosis, supervised low-intensity interval training, LIIT, combined with dietary nitrate, beetroot juice, has shown significant improvements in flow-mediated dilation. For men with proven low testosterone and persistent symptoms despite lifestyle optimization, consider tailored testosterone replacement therapy, TRT, under urologist and endocrinologist supervision, with regular PSA monitoring and estradiol blood viscosity checks. For vascular issues unresponsive to lifestyle, newer agents such as long-acting PDE5 inhibitors, tadalafil, and selective no-donating medications can be adjuncts, but only when prescribed after proper cardiovascular workup. I advocated these protocols for Henrik. After 3 months of daily vascular activation, citrulline-arginine nutrition, stress resilience training, and sleep optimization, his thigh temperature normalized, erectile function improved from 8 to 18 on the IIEF-5, and his total testosterone climbed from 9 mol/L to 15 mol/L, a 66% increase. His story mirrors that of Michael in Paris, Jean in Marseille, Ella in Oslo supporting her husband, and dozens of others who have restored their vitality without dependence on unnecessary pharmaceuticals. Let's recap the evidence-driven road to male rejuvenation. Assessment: self-testing of skin reactivity and temperature to evaluate microvascular integrity. Vascular rehab: 5-minute muscle activation protocol, morning routine, calf pumps, thigh massage. Endocrine nutrition: watermelon juice, nuts, lentils, seeds, oily fish, micronutrient support. Stress mitigation: daily diaphragmatic breathing, muscle relaxation, guided imagery. Lifestyle foundation: sleep hygiene, early light exposure, weight management, zero nicotine, alcohol. Medical support: individualized screening, TRT, PDE5I, or vascular therapy only when indicated. Remember, male sexuality is not a victim of age, but of disuse, vascular neglect, and stress overload. Aging is not mere decline. It is adaptation. To every man watching, your recovery is not only achievable but medically proven when you harness these principles. Please share your intention in the comments. Your courage will empower others. If you apply this protocol, I welcome you to follow up in 4 to 6 weeks and share your results. I, Dr. Lauren Pierce, and a community of striving men stand with you. Make today the first morning you choose action over resignation, science over myth, and connection over silence. Thank you for your trust, your courage, and your commitment to yourself.